Good day, ma'am. My name is Elmer Pulsutin and I'm going to report Lesson 12, numbers 1 to 5. Number 1. Orthodontic. It is pertaining to the proper positioning and relationship of the teeth. Orthodontic is a specialty of dentistry that deals with the diagnosis, prevention, and correction of malposition, teeth injuries, and misaligned bite patterns. It can also focus on modifying facial growth, known as dentofacial orthopedics. Abnormal alignment of the teeth and juice is common. Number 2. Orthopercussion. It is percussion with the distal phalanx of the finger held perpendicularly to the body wall. Orthopercussion is very light percussion of the chest, made in a sagittal direction, that is anteposteriorly and not perpendicularly to the wall of the chest, used to determine the size of the heart, with the faint percussion sound disappearing when the heart is reached, even though that may be overlapped by a layer of the lung. Number 3. Orthopedist. It is an orthopedic surgeon. Orthopedist is a doctor who specializes in the branch of medicine concerned with the correction or prevention of deformities, disorders, or injuries of the skeleton and associated structures. Number 4. Orthosis. It is straightening of a distorted part. An orthosis is the correct term for an externally applied device that is designed and fitted to the body to achieve one or more of the following goals: control biomechanical alignment, correct or accommodate deformity, protect and support an injury, assist rehabilitation. Number 5. Arthropathy. It is any joint disease. An arthropathy is a collective term for any disease of the joints. A myriad or arthropathic disorders can afflict the joints, including sacroiliitis, which causes inflammation in the sacroiliac joint, Charcot's joint, which leads to the degeneration of a joint due to nerve damage, and arthrogryposis, which results in joint contractures.
Good day, ma'am. I'm Dindin Redilosa, and I'm going to continue our topic for Lesson 12. Arthrophema. It is an articular tumor or swelling. Arthrodesis. Arthrodesis is also known as syndesis or artificial ankylosis. It is also commonly referred to as joint fusion. It is a method of surgical joint ossification used to fuse the bones in a joint when other treatments do not yield positive result. Here is an example of ankle fusion. Ankle fusion is an open surgical fusion that fuses or joins the bone together. Ankle is the joints that connects the leg and the foot. The ankle includes the two lower leg bones, called tibia and fibula, and the ankle bone called talus. The next is carpus, the group of 8 bones lying between the forearm and the metacarpals and forming the wrist in humans. The group of bones making up the joint corresponding to the wrist in some vertebrates, such as dinosaurs. Carpus is anatomical assembly connecting the hand to forearm. In human anatomy, the main role of the carpus is to facilitate effective positioning of the hand and powerful use of the extensors and flexors of the forearm. But the mobility of individual carpal bones increase the freedom of movements at the wrist. In tetrapods, the carpus is the sole cluster of bones in the wrist between the radius and ulna and the metacarpus. The bones of the carpus do not belong to individual fingers, whereas those of the metacarpus do. The corresponding part of the foot is the tarsus. The carpal bones allow the wrist to move and rotate vertically. Carpopedal. Carpopedal spasms are frequent and involuntary muscles contractions in the hands and feet. In some cases, the wrist and ankles are affected. Carpopedal spasms are associated with cramping and tingling sensations. Though brief, these spasms can cause severe pain. Muscle contractions in the body are normal. When they become chronic or recurrent, muscle spasm could be indicators of a more serious condition. Here is the symptoms of carpopedal. First, involuntary cramping of your fingers, wrists, toes, and ankles. Second, pain. Third, muscle weakness. Fourth, fatigue. And the fifth is numbness or tingling sensation. Osteitis. Osteitis is inflammation of bone. More specifically, it can refer to one of the following conditions: osteomyelitis or infectious osteitis, mainly bacterial osteitis, alveolar osteitis, or dry socket. The causes of osteitis pubis are multifactorial. This condition is usually caused by an abnormal shearing force across the pubic symphysis, which, as noted, can itself be caused by muscle imbalance, poor flexibility, and joint dysfunction.
Hi everyone, my name is Enrique Resurrection. Our report is all about medical terms, and we will start in osteoma. An osteoma, plural osteomata, is a new piece of bone usually growing on another piece of bone, typically the skull. It is a benign tumor. When the bone tumor grows on other bone, it is known as hyperplastic osteoma. When it grows on other tissue, it is called heteroplastic osteoma. Osteoma represents the most common benign neoplasm of the nose and paranasal sinuses. The cause of osteomata is uncertain, but commonly accepted theories propose embryology, traumatic, or infection causes osteomata are also found in Gardner syndrome. Larger craniofacial osteomata may cause facial pain, headache, and infection due to obstructed nasal frontal ducts. Often of craniofacial osteoma presents help through ocular signs and symptoms such as protesis. So we'll go in osteotomy, a chisel without a bevel that used for cutting bone. An osteotomy is an instrument used for cutting or preparing bone. Osteotomers are similar to chisel but beveled on both sides. They are used today in plastic surgery, orthopedic surgery, and dental implantation. Tendonectomy, excision of part of tendon to shorten it. Tendinotomy was used instead of orbital extraction in 3 cases of malignant choroidal melanoma. In completely removed tumor nodules on the posterior sclera were observed in this case following enucleation. Tendon's capsules certainly the ball implant was removed as a whole and the conjunctives was saved. The procedure resulted in a socket that could be fitted with an artificial eye. Proper preparation of the surgical artificial eye. Proper preparation of the surgical specimen allowed for histological study for tendons, capsule, and the tissues that had been adjacent to the site of the epilobal tumor extension. Tenoropy. Long, tough strands of fiber that forms end tendons to their body origins and insertion. Fatty and areolar tissue that fills the spaces within the fascia around a tendon equinox. Tightness, loss of flexibility in calf and Achilles tendon results in true walking, and the objective is assess the related technology and proportionality of the tenoropy, analyze the diagnostic interaction for a patient undergoing a tenoropy, plan the intraoperative course for patient undergoing tenoropy. And the last is assemble simplified equipment and instrumentation needed for the procedure. That's all. Thank you.
Hello, I'm Catherine Lorraine Pili and I'm going to start about lesson 12, numbers 15 to 18. To start, this one is chondrogenesis. It is the formation of cartilage. Chondrogenesis is required for the formation of the mineralized skeleton in vertebrates. This process begins with the aggregation and condensation of loose mesenchymal tissue to form anlagen comprised of cells. Next one, chondroma. It is a hyperplastic growth of cartilage tissue. Chondromas are benign tumors composed of mature hyaline cartilage. They generally have limited growth potential and are not locally aggressive. Next one is dactyl. It is a digit, a finger, or toe. Prefix or suffix denoting the digits, fingers, or toes, as in dactylitis, or inflammation of a finger or toe. And the last one is dactylomegaly. It is abnormally large size of fingers or toes. It is a condition in which one or more of the fingers is enlarged abnormally. That's all. Thank you.
Hi, hello, I'm Eva Polis and I will be the next and the last reporter. I will be reporting lesson 12, number 19. Brachial, pertaining to the arms. Brachial plexus is the network of nerves that sends signals from your spinal cord to your shoulder, arms, and hands, and brachial plexus injury occurs when these nerves are stretched, compressed, or in the most serious cases, rip apart or torn away from the spinal cord. Brachialia. Brachialia, pain in the arm or arms. Brachialia is technical term for arm pain. It is the toe of the due to the problem with the nerves and compressed nerves in the neck. Brachium. Brachium, the arm, especially the arm above the elbow. Brachium, the upper segment of the arm or forelimb of extending from the shoulder to the elbow. Brachectomy. Brachectomy, surgical of obstetric cutting or removal of the arm. Brachectomy, amputation of an arm to effect vaginal delivery procedure with the knowledgeably available indication in a modern obstetrical practice. And that's all. Thank you.